So thank you, Bona Ashford and Daktari, for joining us in this session, in today's session. And although time has gone, but we'll still continue. The topic for today was asthma. So I don't know whether it's an open forum, as we said. Daktari, would you like to take over and yeah, take it from there, and we can continue. Thank you.
Thank you. Good evening, everybody.
Good evening.
Uh,
To you.
I think before we continue, really want to, I just would want to ask each and every one of us to tell us what they understand when they hear, or what comes to mind when they hear about us.
Mm.
Um,
Well, should I start?
Yes, you may, Ashford.
Yes. What I understand by asthma is that it's a respiratory disease that mostly affects the lungs to the extent that breathing is difficult. It Some kind of fluids come to the lungs and make it very difficult for someone to breathe, and so they get short of oxygen. During that time when they have the attack, I think even walking around is difficult. It's a bad condition. To me, I've never had that attack, but when I see someone suffering, I feel so affected because there's really a struggle with it. That's what I know about asthma myself.
Wow.
Thank you.
Well, Daktari, personally, I don't know. I know very little about asthma, but I know that it affects the respiratory system. Um, and when a patient has an asthma attack, they usually have an inhaler. I don't know whether it is related to the asthma attack is normally triggered by extra or other matters, maybe like dust or what do you call them, pollen, or something like that. I have a cousin who I used to be around and had asthma when he was very young. So I think that's the only, and I saw him using the inhaler. So probably for me, it's not a personal, but an indirect, what do you call it? An indirect experience with asthma. That's all I know about it, and yeah, that's about it for me.
Oh, that's great. Thank you.
Mm-hmm.
Now, how would you define asthma? Asthma is main would define it as a lung condition or respiratory condition characterized by blocking of the airway, mainly due to triggers.
Mm-hmm.
It could be external and at times internal. And when we talk about external triggers, we talk about things like just what you said, pollen, dust, smoke, smells, anything that a human being can be able to react to. And when you talk about intrinsic factor or internal factors, we talk about now things like stress, and others just get asthmatic attacks because of things like fear. And even at times, others get attacks which are related to what they eat or what they drink. So it's quite interesting. Now, looking at it from a different perspective, many people, and initially we thought that asthma was just familial or runs in families. But nowadays we've discovered that that's not the case because of the many things associated with environmental changes. We've seen people developing asthma as a result of constant exposure to those external factors. For instance, most of the people who work in, let's say, places like who do a lot of painting, either because of the vaporization of the paint and the steam from the paints, and at times even not only that, even at times places, people who work in places where you have a lot of dust, like people who work in cement factories. You've seen some of them developing asthma because of the constant exposure to those irritants until now their body starts reacting to them. So, and when you look at it from that particular perspective, we usually say that it's not only those people who have a history of asthma in the family that can experience asthmatic attacks. At times, even those who have never had a familiar or a history in the family of asthma are also developing signs and symptoms of asthma. And that is, would want to say that is a disease of this new age because of it's an industrial age disease. And at times it's also associated with household mites. So when that is not, and the houses are not kept very clean, and you have those household mites in the bedrooms, then they trigger asthmatic attacks. So when it comes to management, in fact, also when we are trying to define asthma, we talk about it's a reversible respiratory condition that affects the airways. But at times there's something else we call COPD, which is not reversible, where now you just have the difficulty in breathing, but it does not resolve. But with asthma, it's reversible. And especially when you use the drugs and when you eliminate the triggers, then we say that asthma can be controlled or, in quotes, cured. But the bottom line is, when you know what triggers your attacks, then we advise you try to avoid them. If you react to cold, if you react to pollen, if you react to grass being cut or things like that, that smell of the grass or dust or smell. If you can be able to avoid that, that means then you can avoid to get the triggers and the attacks. Then that means you are good. I want to pause there and ask a question. When it comes to matters management of asthma, what do you people usually what do you know about the treatment for asthma before we talk about it?
Uh, Personally, I only know that asthma. I didn't know whether it is treatable or not. I thought it was about managing it and managing the condition through the inhaler. I think that's the only thing I know about when anything related to treatment. Yeah, to treatment of asthma.
Um, I have some relatives who are asthmatic. My father-in-law and even some of our kids, and I've seen sometimes inhaler works. Some other times it goes to an extent of having an injection as IV to bring it down. And as the doctor is saying, when the triggers are not there, they live very comfortable lives. But sometimes you may not even know what triggers it. Sometimes a bit complicated, but I know some is cold. Somebody will just touch water, cold water, and they start having the attack. That's what I know.
Thank you. Yes, a while ago, before the era of inhalers, and even when you're talking about inhalers, we have different kind of inhalers. We used to have different drugs that people used to use, which are now outdated, and that is why I thought it would be prudent for us to talk about um, the management of asthma, because um, there were drugs that were used in the past, like Frano, and I'm sure you've heard about them: Frano, Ventolin, uh, aminophylline, all those kind of drugs, which eventually, and that is why most of them have been changed, was realized that they used to cause, yes, they used to help in the release of the attacks, but on the other hand, they had a lot of side effects because it's those same drugs, as they are helping the vessels to expand. In some parts, they're also causing the heart to have arrhythmias and funny kind of, elevate blood pressures and things like that. So, in the long run, um, they cause um, some side effects which were not reversible, and at times which could lead to death to the patients who use them. And I think that is why you see most of the time currently the patients who are on treatment for asthma are using mainly inhalers. And that is why even when you take somebody who has an asthmatic attack to hospital, most of the time what they do is to put them under a nebulizer and now help the patient to inhale the medicine so that at least they can get relief, or they can release the constricted vessels. When that particular perspective, asthma, and that is why I was talking about treating or managing, but it cannot be cured. But most of the time, when you use the drugs the way you're supposed to use them, initially we used to say that when you get an attack, even when you get a relief, your lungs never go back to the original states. Why? Because that kind of edema, I mean, it used to leave some kind, it's like when you have a wound, and even when you heal, that wound does not resolve completely. But with most of the medicine that we're using nowadays, especially when it comes to matters, steroids, inhaled steroids, we've seen they help when it comes to releasing the swelling that had occurred as a result of the allergy. And that means even guys who are asthmatic nowadays, when they take their drugs well, initially, even when, especially I can remember the times during our times when we were in school, guys who are asthmatic would not be allowed to do sports. But nowadays, you still see kids who are asthmatics and they are doing sports very well. Why? Because they have managed, or they are controlled their asthma very well. And that is why I was talking about managing and treating, in quotes, but not curing. Because when the trigger comes, you can still be able to get your attacks again. I hope we are together as far as that is concerned. And I want to pause there, just ask, because for the sake of those who have joined, welcome. I think naona, is it Marianne? Yes. Ama ni Maureen. Helen, karibuni. Kevin, karibu. And Kangetu, karibuni.
Thank you. Mommy.
Yes. Let me just pause there and ask those who have joined in to tell us what they know about asthma, so that at least we can be able to address those issues before we run out of time. And Kubi, I don't know whether James or Ashford can give a brief on what you have gotten so far, so that the others, as they contribute to us the same, they can be able to know where we are at.
Yes. I think I'll just welcome the new members. Take this opportunity to welcome the new members and new participants, and Kelvin for joining us again. We are talking about asthma, and about asthma. And I'll not hog the mic. I'll just hand over to Ashford to tell us something about that also. Ashford.
Okay, Daktari has taken us through asthma, and we have learned that asthma is not just hereditary, but it's also it can develop on people who are not necessarily in the lineage of family that has asthma due to exposure, especially those people who work in areas like industrial areas where like cement factories and such, where they're exposed to that dust, they are likely to get asthma attacks. We have also learned that asthma may not be fully cured, but it can be controlled by taking drugs. And more so, the recent drugs that we take that are taken can really help, especially the steroids. They help the lungs to recover completely. Although the asthma will not go, but they can be able to do their daily activities, including athletics. The drugs that were used earlier on, like Ventolin and Fano and such, are no longer in use because they are not as effective as the current ones, and they had side effects that could cause other problems to the body. I think that's a quick recap. I may not have touched on everything, but I think I got that very easily. Thank you.
Thank you very much, Ashford. That's a very good summary. I think every other person who has joined us have at least an idea of what you're dealing with. And could be if they have a question they'd want to ask, this is your time. Welcome, members.
Thank you, thank you.
Doctor, maybe I have a small question on the steroids. We are told that steroids normally have also side effects. Would they also not have bad side effects in this case?
That's a very good question. I agree with you in totality. Yes, steroids, when they're given through injection or when they're given orally and for prolonged periods, have side effects. And that is why you realize that nowadays we are using inhalers or steroids that are inhaled, so that whatever when you inhale, the only side effect we've seen with inhalers or inhaled steroids is when you don't take good care of your mouth. Like, for instance, after you inhale, we usually recommend, especially when you're inhaling steroids, you rinse your mouth. Why? Because at times that vapor of the steroid at times is left on the mouth, and when